Now, at the onset of the COVID-19 pandemic, experts pronounced that people aged 50 years and above were at a higher risk of contracting the deadly coronavirus disease. But things turned tables when the virus mutated and variants emerged, when we actually found out again that our infants, our kids are not safe. And actually experts again say that the risk in children is actually equal or higher than that in adults. Now, with no one safe, we must turn to experts. And our expert this evening is Dr. Sabrina Chitaka. Dr. Sabrina Chitaka is a pediatrician and a senior lecturer from Makerere University of Uganda National Academy of Sciences. She has specialized training in pediatrics and infectious diseases as well as adolescent medicine. We will turn to her and seek her opinion on the extent of this risk of COVID-19 in children. Dr. Sabrina, welcome to the program, and you are live on Soul TV. We would want to hear from you. What is the latest about the risk of coronavirus in children?
Well, thank you very much, Apollo, for inviting me to be on this show. I'm truly grateful, and I'd like to correct some misnomers right now, that whereas children are also getting infected with COVID-19, they still stand a less risk of getting severe COVID-19. In this current wave, we are seeing a lot of patients suffering, but still not many children. So we know that children are equally infected like adults. On a daily basis in this country, nearly 1,000 people are tested, but about 10% are children. Children do suffer from COVID-19 just like adults, but their symptoms are milder. They tend to suffer from a mild cough, a mild flu, and they may also get a headache or diarrhea and stomach ache. But there are some children who develop a severe form of COVID-19, which is also called the multi-inflammatory systemic syndrome. And this syndrome is quite disastrous. The children may end up getting admitted, and also they may be critically ill. There are children who with comorbidities like sickle cell disease, comorbidities like chronic kidney disease, comorbidities like cardiac illness, and even those children who are immunosuppressed because of various reasons. Children who are getting chemotherapy, children with severe HIV disease may get a worse form of COVID-19 disease.
Symptoms, I would want you to tell parents who have children at home about those key symptoms that they may look out for to understand whether their kids have contracted COVID-19.
Okay, thank you very much. First of all, we need to understand that when a person contracts COVID-19 disease, the incubation period is between 2 days to 14 days. So if a child gets exposed to somebody who has, within 2 days, they may start showing symptoms. And those symptoms include high fever, which is above 37.3. They may get a headache, they may get a sore throat, they may get a runny nose, but they can also just present with abdominal pain.
Does that apply to this, the babies, the sucklings? Does it apply to those young babies?
Oh yes, so even little babies can get COVID-19 disease. The youngest baby that I have treated was a 3-month-old baby who had COVID-19 disease. And even some mothers who are breastfeeding their 2-week-old babies have tested their babies positive. So these babies may present with refusal to breastfeed, they may get a high fever, but they may also get a runny nose or even pain in all their entire body may be painful.
Right, I understand you treat children at Mulago Hospital. Do we have children, young kids in extreme conditions, for instance, ICUs?
Yes, Apollo, we have seen children who are critically ill. Even yesterday, we received a 10-year-old boy who had been treated in a peripheral clinic. He had been treated for malaria, then he had been treated for typhoid fever, and by the time he came to us in Mulago, he was very, very sick. He had low oxygen saturation of 88, and he had joint pains in every single joint. He had severe abdominal pain, and when we tested him, he tested COVID positive, and we stabilized him and sent him to the COVID treatment unit. About a week ago, I received a 17-year-old girl who had sickle cell disease and chronic kidney failure, and she was critically ill, and sadly we lost that child.
That's sad news, doctor, but of course that happens, of course. And I want to hear from you. In adults, probably it could be easy to treat a patient because they can speak, they can tell you how they feel. How difficult, how tedious is it?
Yes, that is true.
Is it to treat children, especially those with COVID-19 symptoms?
So when a child is very young, sometimes a wrong diagnosis can be made. And just like I shared with you, the child who came to us yesterday, he was a 10-year-old child who had been treated for malaria. He'd been treated for typhoid fever. And by the time he came, he had complications. So sometimes healthcare providers do not have a high index of suspicion for COVID-19 in children, but also parents are not aware that children can actually get COVID-19. So in this epidemic, it's very important for all of us to understand that COVID-19 can happen in any child at any age, and we should have a high index of suspicion for COVID-19. So if there is an adult who has COVID-19 in the house, it is very, very important for all of us, first of all, to protect the children. The adult has to wear a mask, but also if the child starts to get symptoms, it's important for that child to be tested and the correct treatment is given.
All right, I again would want to know from you, we know that masks are advisable to people above 16 years. I don't know if that's correct, you'll tell me. What happens if I have a kid at home with the COVID-19 symptoms or is sick? What do I do? Isolation is possible. What can I do?
So it isn't true that only people above the age of 16 should wear masks. The Ministry of Health Uganda has advised that children above the age of 6 can actually wear masks. And the CDC in the United States has even advised that you can give a child as young as 2 years a mask to wear. Masks are safe, but what we all need to know is that the child should not wear a mask for the whole day. You should reach a time where you take off the mask and encourage them to breathe in fresh air. Children shouldn't be wearing masks when they are exercising. So yes, children can wear masks. I do appreciate that a lot of people in our community live in very small spaces, and isolation may not even be an option in some homes. But continuing to wear masks in the home, washing hands judiciously, sanitizing surfaces and sanitizing your hands is extremely critical and important to lower the risk. But also getting treatment for that individual so that their bodies are immune boosted and they are able to fight off the infection.
All right, let me hear from you again, Dr. Sabrina, about the timing, exactly when I need to take this kid to professionals, to a health facility, after I found out that she or he or it has COVID symptoms.
All right, that's a very important question. So, like I said, the majority of children do have mild symptoms. They don't need to even be admitted. They will recover when you give them paracetamol, give them some multivitamins, increase their uptake of food, and also allow them to rest enough, give them lots of water to drink, they hydrate, they will be fine. However, for about 5% of those children, they will get severe symptoms. If the fever is not going with paracetamol, if the child starts to breathe with difficulty, that's a danger sign. If the child fails to pass urine, that is also a danger sign. So it's important for parents to understand that whereas the majority of patients will have mild symptoms, some children can get into the critical phase, which we call cytokine storm, and they need to be brought into hospital urgently. Like I said, high-grade fever that is not stopping, very bad headache that doesn't seem to stop, a child who refuses to eat, and also if a child has difficulty in breathing.
Oh, that's important there, Dr. Sabrina. But again, I would want to know from you how probably I would take care of myself, because we love kids. When we go home, we want to hold them, to bring them and sit them on our laps. Can a parent contract COVID-19 from his or her kid?
Definitely, yes. A child can transmit COVID-19. Remember, COVID-19 grows in the back of your mouth and it can be present in saliva. So if that child is talking to you or singing with you and they are breathing next to you, they can actually infect you with COVID-19.
Sad anyway, because it...
But you see, COVID-19, COVID creates a very difficult situation. It has created a lot of unusual states. Parents, the usual thing is for you to come back home, hug your child, be comfortable with them. But we have learned that now we have to be careful. For example, when I come back from work, I don't rush to hug my child before washing my hands and even removing my work clothes. So we just have to be careful, all of us.
We must be careful with the COVID-19. Dr. Sabrina, let's look at another important issue as we wind up. We know that besides SOPs, washing hands, sanitizing, and all those things, a healthy diet is important to fight the disease. Talk about the diet for children, those that have not contracted COVID-19. How can we help them boost their immunity? What is that kind of food that we should feed our children?
So yes, food is health. If you eat well, you're likely to live well. And a balanced diet is absolutely important. We know that for babies below the age of 6 months, their best food for them is breast milk. So mothers, please breastfeed your babies actively. But for babies who are older, who are able to eat, it's so important for us to have a balanced diet. And that balanced diet is typically a plate of food that has 5 different colors of food. You know, the green leafy vegetables, that has a lot of zinc and magnesium and manganese. But the orange food or even the fruits contain a lot of ascorbic acid, which is useful in treating viral infections. Vitamin D is present in milk and blue band, but water is life. The more we hydrate, the more our kidneys are able to function, the more likely we are to be able to fight off the COVID-19. And please do not misunderstand me. I have not said that go and drink a whole bucket of water. I'm just saying take enough water that is relevant for your body size. So a little child of 2 years should be able to drink a liter of water on a daily basis. And then for older people, like my size, you should be able to drink 3 liters of water on a daily basis. The other important thing is sunshine, pure sunshine. So allowing the children to go out and play in the sun is so important for them. But giving children body-building food like proteins and carbohydrates, and we have loads of those in Uganda, those are very important. We have important fruits in our country, particularly pineapple. Pineapple is being tried in Australia, especially the middle part of the pineapple, to treat COVID-19. It contains an enzyme called bromelain, and therefore eating pineapple is extremely important in this time when we are having a raging epidemic.
As I let you go, Dr. Sabrina, with rising cases and rising infection, of course, cases of infection in this country, what can you say should be the key component that should be looked into as we move on? Because you must have that information with you.
Certainly, yes. And I think one of the most important public health approaches to preventing transmission is breaking up crowds. The current lockdown that we are undergoing is one of those measures. Breaking down the crowds, making sure that people stop the transmission, but also making sure that those who are ill access the correct treatment. Please do not self-medicate. I keep saying that. People are imbibing literally kilos of antibiotics and even some medication like dexamethasone, which can harm your body. So if your child is sick, or if you are sick, please call up a doctor to give you the correct prescription. If you're critically ill, call for an ambulance. The KCC has ambulances, and even the Ministry of Health has an ambulance service. They will come and pick you up so that you can get close to their dear ones. At this time, it's very painful, it's very hurting, but we pray and believe that this too will end. For those of you who are eligible for immunization, please go and get your immunization. Thank you.
But parting shot, is the treatment for children as expensive as what we see now in adults?
So, healthcare is expensive. And if a person is critically ill and they have to go into the ICU, that is the intensive care. Unfortunately, whether you're a child or an adult, that is going to be expensive.
So much, Dr. Sabrina Chitaka. I'm grateful, and of course that is good information that you've shared with our viewers here at Salt TV. There she is, Dr. Sabrina Chitaka, a pediatrician and senior lecturer from Makerere University, and she is also a fellow of National Academy of Sciences, with specialized training in pediatrics, infectious diseases, and adolescent medicine. Thank you so much, viewers. You've heard it from the horse's mouth. You know now that even our kids are not safe. And if at all they get infected, you know what to do. The Limelight, it will be coming back next week. I must say good evening and stay safe.